Hello, my name is Darshan Mehta. I'm the chair of the membership committee for the academic consortium, and we are really excited to have with us our newest member, the University of Arkansas for Medical Sciences, and really excited to have Dr. McElfish and Dr. Way as the representatives for the University of Arkansas. So this is really exciting to have our newest member here. I just wanted to invite you to just tell us a little bit about your program at the University of Arkansas for Medical Sciences.
So the University of Arkansas for Medical Sciences is a statewide institution, and we have two primary campuses, one in Central Arkansas and Little Rock and one in Northwest Arkansas. And so we're really excited to be able to implement integrative medicine throughout all three of our missions of education, research, and clinical care in both of our sites. And Dr. Way is going to start by talking about some of the clinical ways that we're focused on integrative health, and then I'll follow up on some of the other areas.
Thank you, Dr. McElfish. Thank you, Darshan. We are deeply honored and we are delighted to be invited, and we accept this wonderful honor to be a part of the consortium. I'm a geriatrician, as well as an internist, as well as a cardiologist. So we've been practicing holistic medicine for our patients for quite some time. We understand that it is very important to take care of the whole patient, and we are willing to apply almost any modality that will help to benefit the patient. With that kind of approach, what we've done is we usually do go to include not only the traditional allopathic medicine, but we also include alternative, complementary, as well as other modalities that the patient sometimes recommends, because they sometimes know better what helps them. So the idea for us is to be able to offer a patient everything that we know that we can to help the patient to maintain as high a level of health and function for as long as possible. Because I'm a geriatrician, most of my patients are mature. And actually, to tell you, our clinic, the median age in our clinic is 86 and a half. We're very fortunate. So what we practice really is to take care of the entire person as well as the environment around the person, because it takes a whole village. So we also take care of the person, caregiver, and family, and it always reflects positively all the way around if we're able to help every member of that environment. Some of the complementary and alternative modalities that we utilize are the ones that are well known to everybody. And of course, they include, the meditation, they include yoga, they include acupuncture, which I actually previously practiced when I was a medical student at the University of Illinois. Dry needling, which Dr. McElfish is sponsoring and is underway in Northwest Arkansas, but we also have it here in Central Arkansas. We also have, as I mentioned, meditation. We also have a number of modalities, including culinary medicine. We both are undertaking that, but we also have other things, so that we believe in whatever it is that the patient views as helpful. Now, I just read an article yesterday that talked about patients with fibromyalgia finding it to be very positive, very uplifting, and very much improving for them if they can do flower arranging. So I actually worked in a florist shop before too, and I know how uplifting that can be. So that's something we might also consider, although we have not yet offered it, but we will. I'm going to ask Dr. McElfish to comment now on some of the other modalities.
Thank you, Dr. Way. And Dr. Way is our leading integrative health physician at UAMS. So really wanted her to speak to the treatments and therapies underway. In addition to clinical care, we feel like it's incredibly important to integrate integrative health into our learner curriculum. And so we are focusing on how to have integrative health, integrative medicine as part of the interprofessional curriculums. UAMS is one of the nation's leaders in interprofessional education. We have requirements of certain classes that doctors, nurses, pharmacists, physical therapists all take together, and are working with our provost and our dean of medicine to have integrative health be one of those required integrative medicine, or having integrative medicine be one of the required interprofessional courses that all of the professions are taking and taking together. As Dr. Way said, one of the things we kicked off about a year ago was culinary medicine. It is required by all professions. So doctors, nurses, pharmacists, all the health professions take culinary medicine together on all of our campuses. And so we're looking to really have integrative medicine touch all parts of the campus, not be one small thing that's hidden within one department, but something that really permeates all areas, because as Dr. Way said, we see it really as how do we treat the whole person in the most holistic way possible. And so I'm excited about that. Research is another area where we are really excited. So my personal research is on improving sleep hygiene as a way to prevent and treat diabetes. We have researchers who are doing some great work on Tai Chi and just other areas where improving the evidence base for holistic therapies is something that we have not only Dr. Way and I are passionate about, but we have a team of about 20 researchers who are really passionate about really improving the evidence base around integrative health.
It's really wonderful to see this beautiful triumvirate of evidence-based clinical care, really research innovation, obviously dynamic and fluid interprofessional education. So really wonderful to see all the amazing things that you already have done, and look forward to learning from you as the body of consortium gets to know you. One just follow-up question is, what are you hoping to achieve as a member of the academic consortium?
I think really learning from the other members, obviously sharing where we have assets. Probably in interprofessional education is an area where we've excelled, but also learning how some of the other consortium members have pulled together the different pieces of integrative health that they're doing into one identity. I think what we were both, I wouldn't say shocked at, but were pleasantly surprised is that when we really did a taxonomy of everything we were doing regarding integrative health across the campus, it was far more than even we understood as the leaders of integrative health. But we have not done a good job of having integrative health have a firm identity in our university. The second thing that I'd like to ask Dr. Way to speak towards is, how do we make sure that integrative health, integrative therapies are accessible to all? So that it's not just some kind of boutique that highly educated, wealthy people have access to, but how do we make sure that people who have limited insurance, limited means, and are in rural areas have access to these holistic treatments? I know that's something that Dr. Way is very passionate about.
Thank you, Dr. McAlfish, and I completely agree. We're looking forward to learning from all the colleagues in the consortium, because we have a lot to learn and we can't wait. We also would like to share with our faculty and with your faculty And what we'd like to do is learn how to implement, just as what Dr. McElfish said, across the state, across multiple layers, which is not easy to do, as you can understand. We are a mostly rural state, and we have, within our state, we have the entire spectrum from the lower socioeconomic status and areas with the very low life expectancy, among the lowest in the whole United States. And then we have other areas where the life expectancy is much higher and it's among the highest in the United States. How do we bring that together? How do we come together so that we can support everyone? So those are the things that we're both looking to learn from the consortium, and also we want to share whatever we find might be helpful, because I think there's going to be many more areas that's going to need help, if you will, and if any one of us can share, it'll help everybody else. So that's what we're hoping.
Well, we are really, truly excited to have you be our newest member, and we're really excited for your enthusiasm and already the wealth of expertise that you bring. I look forward to actually meeting you in person in Cleveland in the springtime, and really thank both of you for your time to just share with all of us and our body as to just who you are, what your sort of core mission is, and look forward to just learning from you and learning with you as we move forward. So thank you so much again for being for taking the time to become a member, and look forward to your really important contributions to our academic body.
Thank you.
Thank you.
Thank you so much. We can't wait.